Hello, everybody, and welcome to the presentation of this article, An Improved Immunization Record to Support Vaccination During the COVID-19 Pandemic at a University Hospital in Argentina. My name is Joya Núñez, and this is the entire team that worked together. So, according to the World Health Organization, vaccination is the most cost-effective method for the prevention of infectious diseases. An effective public health strategy requires efficient tracking of vaccination to assess coverage, safety, and efficacy of these vaccines. There are many places that continue to use paper-based registries with many disadvantages, both for the public health and patients. This can be improved by implementing a well-designed electronic immunization record that allows for a nominal national registry and that surpasses simple quantitative registries. This way, it would improve resource management in immunization. It also facilitates the creation of a digital vaccination certificate. In this article, we share our experience with the redesign and implementation of a new interoperable immunization record on the electronic health record in the Italian hospital of Buenos Aires during the COVID-19 pandemic. The setting is the Italian hospital, which is a charitable society with a network of health services in Buenos Aires, Argentina. It has an information system that is homegrown, and it's certified by HIMSS as a level 7 in the scale of electronic medical record adoption model. This electronic health record supports vaccine prescription and administration, and it generates immunization cards for each patient. All vaccine administrations are automatically reported to Federal Vaccination Registry, which is called NOMIVAC. The objective of this article was to design, develop, and implement a new immunization record that it would record vaccine prescription, vaccine administration, and also the tracking of the vaccination status in order to enhance the data coverage and quality, and to include new processes like the COVID-19 vaccine campaign in the electronic health record. For the methodology, we applied an user-centered design approach so we could leverage the experience of the team in developing a similar immunization application for the Ministry of Health of the city of Buenos Aires. The application uses the FHIR HL7 API, which is a standard to enhance interoperability with other national vaccination registry. This vaccination record was designed and tested with multiple users to ensure a good user experience and guarantee an understanding and satisfactory interaction with the necessary resources. It also contemplated its use both inside and outside the Italian hospital of Buenos Aires. We started by mapping the whole immunization process from end to end, and with that we assess all the use cases and user journeys. As you can see in this image, a vaccine can adopt different status, which are prescribed. That this means that a medical doctor has extended the vaccine prescription, not administered when it had the indication, but they were not able to administer it. This could be for many reasons, like contraindications or expiration dates, or any other number of reasons. It can also be administered when the vaccine has already been applied, and it can be registered, which means that the vaccine has been applied sometime before, and we just want to add it on the record. Each change between this status requires an action taken by the a healthcare professional using the electronic health record. With the COVID-19 pandemic, we were forced to add some changes to the initial project. We had to include and implement a special section to record this vaccine campaign within the hospital. We deployed a special button that was called Coronavirus Campaign, and this button leads to a modal where healthcare workers specify the details of the administered vaccine. This information comes preloaded to make this process easier. The data is then recorded and reported to the public health authorities automatically. This interface is linked to the standard API FHIR resources for immunization using terminology services that code for every vaccine. So immunization is a domain where paper-based records still persist widely, both at a physician's end as well as a patient's end. And this electronic record solution enables a standardized process available to patients, providers, and any other actor involved in this whole process. And it creates structured reports that are sent directly to the public health agencies. It also enables a vaccination certificate based on this NOMIVAC collected information that can be accessed from anywhere at any time. This contributes to a decrease in costs associated with the revaccination for the lost certificates. This solution could be extended and replicated in other scenarios as well, given that it was designated and developed taking into account the recommended standards. It could be particularly useful for primary and community healthcare by improving health information, management for vulnerable populations, achieving better quality indicators, and allowing the design of better and more effective strategies. The limitations of this article were that it was conducted in a single health center, and it used only in-house developed software. So this means it might not be representative of the reality in other institutions. So the proper collection of quality data allows for critical analysis and enables a better decision-making process for healthcare on an individual and population basis. Interoperable systems coordinate the information exchange between healthcare providers and public health agencies in order to support their operation with updated data. This can be particularly helpful in emergency health crises such as COVID-19 pandemic. In this scenario, electronic immunization records may function as the cornerstone of an efficient vaccination campaign. The next steps include the development of a multi-platform applications, web and mobile, to reach other users involved in the immunization processes. This would allow patients to visualize and report their vaccination status. And also we would like to incorporate clinical decision support system tools designed to improve adherence and education functionalities. The main focus should be on vaccination reminders and opportunities, and also interaction between vaccines and chronic diseases. This would help manage the complexity around the whole vaccination process. Additionally, public health agencies would receive immunization data to take necessary actions in compliance with the law. And adding an API FHIR resource to this platform would promote a timely and effective exchange of data. Future mobile implementation of this application would ensure a reach in a country like Argentina with high penetration of mobile phones and connectivity. So we think that future local research should expand on this subject. This was all for today. Thank you very much. This is my email if you have any questions or comments on the article.